the theme that Katie kind of left us with last night about, today being more solutions focused, and even the kind of call to action that we got from Molly. It was a great segue into Greg and I's topic today about innovation. How many of us have, especially when you come from large institutions, hospital systems, payers, we have the resources. We want to jump right to the solution, right? We've heard all the history and the research around social determinants of health, and we're like, let's just get to it. How many of us have done that, right? Let's get to the right solution. But how many of us have had to maybe backtrack a little bit, right? Our innovations that within our systems have, we're well intended, right? We want the greatest outcomes, but a lot of times we forget those small steps. And one of those real small steps is involving the people who are most suffering from these disparities in our design, in our innovation design. So today I'm going to tell two quick stories. One of them I'm really, really familiar with. I was in the middle of that. And another one was a colleague of mine in San Francisco. So we'll start here with do I have the advance the slides? Where? I should have been standing up here, right? Sorry. So we'll start off here in the west side of Chicago. So here's the innovation. Well-known healthcare system sponsored a multi-sector coalition promoting community health, health equity, and transformational systems change in communities of concentrated poverty, right? Now, the aim was centered around food justice at this time. There was a lot of grants within the area. Went to the community, had focus groups, and the idea was to start this transformational change around food justice. This was a food desert. To give a backstory to food desert, so wanted to promote entrepreneurship, eliminate the food desert, and introduce healthier options within the area. But then all the time, and you jump right to it, and you don't see the hidden barriers sometimes, right? So we had the urban agricultural business was a concept that the health system thought would close the disparity gaps, and I just thought it would, right? This focusing in on promoting business, community development, are primary drivers towards closing some of these disparity gaps. So we recruited urban farmers from the city to take part in different projects. We hired a large company from the city who had done this well to do the training. And after a pretty large investment from the local hospital system and further funding to operate a farmer's market. And a quick story, I was there at the first farmer's market, and I was the only one there at the first farmer's market, along with the people from the hospital system. So what did we go wrong, right? We realized that the farmers had no active market to sell their produce. This led to wasted dollars, like I said, no customers, and further division from those people we recruited who took their time out of their lives to take this training, the hospital system, and the community involved, who were pretty upset that they weren't truly involved in the entire process. So we have this beautiful park here in an area of San Francisco called the Tenderloin. So what was the innovation? Another well-known hospital and its foundation was partnering to serve as a backbone. So they had the idea of the collective impact, the backbone for a place-based collective impact approach of addressing the social determinants of health in the TL. So they wanted to have the ability for the children and families, especially going to school, have a little safe zone to go to school. So they wanted to not only walk safe, but play outside, because we knew that can greatly impact overall health, people's life expectancy, and just overall mood and happiness. The innovation was to renovate and develop parks throughout the TL for families to use. Great idea, right? So just like my idea, last slide, they jumped right to it. even building parks. But they realized once they cut the ribbon that that was only the beginning. The new park looked beautiful, but it didn't solve any of the safety issues that kept the families away originally. The parks were still being underutilized. There was still drug dealing, and drug use was just as prevalent. And there was no alternative for people who were using the parks as their primary residence. So we'll bring up Greg to talk about the concept of the hidden barriers.
All right, thank you, Drew. So Drew's stories illustrate this idea that we've been talking about, the hidden barrier to innovation, something we've both experienced in our own work, and we suspect that maybe you've experienced it in your work. That the success of the innovations that Drew was talking about in the Tenderloin and in Chicago really depended upon the behavior of stakeholders in the environment. And that when those stakeholders behaved in ways that were unanticipated by the innovators, that became a real barrier that derailed the innovation. The intended consumers of the farmer's market who didn't consume the products that they brought to the market. That was a hidden barrier. The concern for the residents of the Tenderloin, the primary concern that they had for the safety of their community, of their park, and that when building the park, that was not something that was really considered as a primary goal of the park. They didn't use it and get the exercise and improve their health in the way that was intended. So behaviors of stakeholders that are unanticipated by the innovators are hidden barriers. That's the concept that we've been working with. I want to ask you to think about that for a second and consider your own work in this space of innovation to improve health equity in the communities that you're working in. And I just want you to consider whether you have confronted any hidden barriers. Now, I want to ask for a show of hands, but I'm not going to ask anybody to give examples. I'm not going to ask for details. I just want to know if you've had an experience of confronting a hidden barrier in an innovative project that you've worked on. Just raise your hands. Okay, good. So we're not alone. That makes us feel a little bit better that all of us have blind spots in the work that we're doing. The other thing I want to ask you, so when Drew shared these stories with me, I have to say I was sort of like, wow, how did they miss that? Like, how did the innovators in the Chicago neighborhood who were really thinking about urban agriculture and entrepreneurship and thinking about how they could sell, produce from urban farms to community members, how did they not really consider whether or not there was a market for the things that they were producing? How'd they miss that? And I wonder if you think about your own example of an innovation where there was a hidden barrier, if you're looking back on it now, does it kind of strike you as like, how did I miss that? And that's the question that we want to ask next. Why do we miss things that seem so obvious once revealed? Isn't it obvious, right, that safety was a primary concern, and if you don't really address the drug use and the homelessness and how that is going to affect the park that you're putting together, that it's really going to unravel the whole enterprise? How do you miss that? So, 1 minute, think about it. Why do we miss things that seem so obvious once they're revealed in this space of innovation? Any thoughts on that? Yeah. Time urgency. Say more about that.
Sometimes innovations are driven by a philanthropic opportunity, maybe an organizational mandate, and we kind of jump over the whole thinking it through process.
Okay. Another, Scott?
I would wonder whether all the stakeholders that needed to be there in the planning phase were actually there. We have this in our institution. I represent the docs, but I don't think like any of the other docs in my hospital. So that's dangerous to have me representing the docs. I am a physician. So, you might think you have the right stakeholders, but maybe it needs to be more diverse.
And could that be related to the time urgency issue? If you've got to get your innovation out quickly and you've got to demonstrate results to your philanthropic partners, do you really have time to engage, right, all the right stakeholders? Any other thoughts that are different? Yeah.
Daniel Kahneman, the psychologist, has a concept called "what you see is all there is," and that is
What you see is all there is.
what you see is all that is. The thing that is right in front of you that you're focused on is the whole world, and he's documented really clearly that it's very easy to sort of cut out other parts of a system in your mind if you're focused on one thing, and that's a problem.
That's like what you don't know that you don't know, right? I mean, you only know what you know, and there's so much more, but you're so tunnel focused. John.
Yes. So I think the great points by everyone. The thing that in terms of innovation people don't think about is the standard operational process by which you go through and develop something really doesn't consider stakeholders. So you see it all the time in entrepreneurship where it's called product market fit. You're producing a fantastic product that no one wants to use. So it's one of those things how we generally do operations or production in anything typically is not designed so that it actually fits the needs of the end user. It fits the needs of the people who are developing it.
Okay. So it's not in our culture, it's not in our standard operating procedures, it reflects that kind of we only see what we see. I want to go back to what Bob said. Some of these things that we're talking about here tend to reflect that time urgency that we, when Drew and I had been putting this together and looking at the research on what's going on in organizations today, what we find is that a lot of people kind of feel like this, you know, in their innovative work, which is to say that we're moving really, really quickly, and we feel the urgency to demonstrate results quickly, and that most of us, how many of you are juggling more than one innovative project right now? Right. And so it's not that we are so siloed in our basic orientation to the world that we don't understand that we should be engaging and listening a lot to those around us, but we just don't feel like we have the time to do that. And this seems to be borne out in some of the research that's being done, particularly around how technology might be affecting the work environment. So we are using email, we are using text messaging, we are using video conferencing, we are using other communications technologies that promise to enable us to do more in less time. But it might be having a subversive effect on our organizations, but instead of giving us the opportunity to do more in less time, freeing us up, making our lives easier, it's actually raising the bar on how much is expected of us. We just are expected to do more. And by doing more, we're simply not able to give each thing that we're doing the detail and the conscientious focus that it deserves. There's some research that's being done, you can Google this, from Deloitte, and it's based upon a lot of secondary research around the utilization of these communication technologies and how they're affecting the workplace. And a couple of quotes here from the report, that workers are actually experiencing more stress, more frustration, and time pressure and effort rather than less, which is what the technologies are supposed to do. And organizations often experience decreased employee performance, not increased, and less optimal business decisions due to the lack of adequate time to sufficiently weigh pros and cons and consider and evaluate viable alternatives. So that's some evidence to support this hypothesis that Drew and I have been operating, which is that, look, we're smart enough to know that we really need to engage our stakeholders, but how do you create the conditions that really support that kind of behavior? So we're not going to try to solve that problem today. We can talk about policy, and we can talk about organizational design, and we can talk about new ways of using technology. What we want to do is introduce something that we have found is a useful way to slow everything down. So thinking about, by the way, has anybody seen this TED Talk by Ralph Simone, the leadership coach? It's called Slow Down, Go Faster. You can Google it. Don't do it now. It's about 16 minutes. We need your attention here. But this idea, you know, it's actually an idea from martial arts. It's this idea that, like, the fastest martial arts experts in the world, the ones who are kicking so fast that you don't even see them, they actually operate from a mindset where they breathe really slowly, so everything is coming at them really slowly, so they see everything, and they're able to respond more quickly. It's this idea that like you slow down to go faster. So what we think is if we slow down the process, find tools to sort of put a wedge in that speed, it'll actually enable us to go faster later. We're still going to see barriers, but we're going to address them before they become devastating to our innovation. So the tool we're going to use today is called Peer Consulting UFO, and you're going to see what this means in a minute. And by the way, this is the abridged version, ironically, right? Because we don't have a lot of time to do it the way that we'd like to do it. It takes about 90 minutes to do this the right way. We're going to do it in about 25 minutes because we want to give you a taste of the process. And the process is really based on the idea that, yes, each of us does only see what we see. There's no doubt about that. Each of us only knows what we know, and there's some things that we don't know. But our peers can help us see things that we don't see. And our peers can push us and nudge us to look at things that we may not even want to look at. So we can rely on each other to reveal those blind spots, to reveal those hidden barriers so that we can address them adequately. That's the basic model. So we actually have innovators in the room, and Molly Castaldo's done a fantastic job at engaging a number of you to show up today and be prepared to present an innovation. So if you're one of the innovators, can you just raise your hand? Okay. Do we have an innovator at every table? We have an innovator. Oh, excellent. All right. So
I think Mary needs a couple more folks at her table. So if you're at a table full, just please
perfect.
Raise your hand, Mary. All right. Yeah. Thanks, Kev.
If there's a table that's
with 8, maybe somebody can move over to table number 4, maybe 2 more people.
yeah, this works optimally with 6 to 8 people. So if you're at a, looks like we're calling out table 8 as a table that might be overpopulated. Okay.
Well, yeah, some tomatoes on tables, but we have had a little attrition, so.
I think we're doing well. I think we have an innovator at every table, and we have a decent number of people at every table.
Perfect. Thank you.
So first of all, we want to thank the innovators for showing up, being prepared to present. And here's the thing. It does require a little bit of vulnerability to present a case where you're asking people to help you see your blind spots, right? So it's, okay, you've heard this before. What gets said today stays here today, right? So allow them to be honest and authentic about the case that they're putting in front of you by really, holding the trust that you're not going to walk around and say, gee, such and such is doing this thing, right? And it got revealed that such and such, okay? So we can just agree on that, right? Confidentiality. So this is, in very quick overview, there are 4 steps to this. And each step is detailed in a set of protocols that are in the manila folders on the tables. So you can open those up when you're ready. And I would just ask if at every table we have a very, very quick decision to have one person be the facilitator at the table. It's a simple job. It doesn't require a lot of training. Just be the one to kind of make sure that your table kind of moves through each phase. Let's do that right now. Take 10 seconds. This is quick. Okay. We got a facilitator at every table. Thank you. These are the phases. This is what it's going to look like. We're going to kick this off, and I'm going to have some questions to guide discussion on the slides as we move through, so you'll be able to look at those for guidance. And in the first case that we'll go to, in the first phase that we'll go to at the beginning, the innovators are going to present their case, and they're going to only have 5 minutes. In the real world, you do this in about 15. So they're going to have 5 minutes. At that point, very important, facilitators, hold your people accountable. Nobody is speaking except for the innovator. This is important to the discipline. We're listening to this person. We're listening to the tone of his or her voice. We're listening to the things that are comfortable to talk about, the things that are harder to talk about. We're letting them speak completely. After 5 minutes, and we have a timer, we'll move to the next phase. You are going to gather more information about the case. You'll look at those protocols and see if those questions help you to push and nudge the innovator to see if you can reveal more of what might be hidden from that person as they move forward. Not the time to give advice. Do not give any advice at this point. You need to learn more before you give advice. Often we jump to advice before we even understand the problem. Third, the peers are going to work on the case together. This is when the innovator gets abducted by the UFO. All right? And so they are unavailable to speak. They will sit and they will listen. They cannot speak. Facilitators at the table hold your innovators accountable. They have been abducted for 10 minutes. They'll come back and you will make a consultation to them. So in that 10 minutes, we want you to be thinking about what would we like to leave the innovator with? What recommendations would we like to make to the innovator that they could walk away with and run some tests and ask some questions and do some things that would help them see more of the environment that they're operating in. All right, make sense? Everybody ready to go? So we're going to get started on the first phase. 5 minutes, let's go. Okay, that's 5 minutes. We're going to go to the next phase. Group gathers data to deepen understanding of the case. The group members are asking clarifying questions of the innovators. This is not the time to make recommendations. This is not the time to give advice. Learn more. Learn more. 5 minutes. It's time to be abducted by a UFO. If you are an innovator, you are disappearing in a beam of light. Don't worry, you'll be safe. You'll be back again in 10 minutes. So here's what we're going to do. The group is going to work on the case together and the innovators are not going to speak. Facilitators, please hold everybody accountable to that. These are some questions to guide your discussion. After 10 minutes, have a few recommendations for your innovator, because that will be the last phase. You'll be giving recommendations to your innovator. Everybody ready? Innovators, you can sit, but you may not speak. Yes, Rob. Yeah, it's okay. It's okay. Yeah, it's okay if the innovators stay. By the way, if you, as an innovator, if you would like to leave the room, you may. But you're welcome to sit at the table. Okay? Go ahead. Okay, folks. So we're going to move to the last phase of this. 5 minutes. This is time to make your recommendation. If you are an innovator, you've just come back from the UFO, if you're out of the room and you can hear my voice come back into the room, it's okay for the innovator to react and respond to the recommendations. This can be a dialogue. 5 minutes. Okay, so that's the time. That's the end of the last section. So let's wrap it up. What we want to do is we want to debrief now. We have about 5 minutes left in the section, right? Molly, how much time do we have left? 5 minutes. Okay, so we just have 5 minutes. What we want to do is we just want to hear from a few innovators and tell us what you saw that you hadn't seen before and how it's going to help you to move forward.
Thank you. So, Sue Ellen Griffin, class of 15. So my issue, the inequity, was that people that have a chronic mental illness die approximately 25 years younger than the general population for many, many reasons, but they do. We see it every day at our community mental health centers. So the idea was, how do we improve access and quality to care for these folks that have a chronic mental illness? So the group met, and there were a few things that they recommended that I think were very useful to take back, and that was thinking about, and we've thought about this, but we haven't focused on it, which is to put primary care in the mental health setting. The innovation was that we do a shared care plan, which we're doing with primary care and with the behavioral health center. And so that's successful. We're also training our case managers to do motivational interviewing with our clients to get them engaged in their care, because so often the patients aren't engaged in their care. And so that was the innovation. But the idea of also thinking about not just engaging those two parties, but to bring primary care into the mental health side was one. And the other was the use of peer supports. We do use peer supports for another program, but the idea of using peer supports to call people at home see how they're doing, see what they're, whether they're doing okay, whether they're following a schedule. Our case managers do that a lot, but it would be additional support, I think, for our case managers if we involve peers. So there's a couple of really concrete things to think about.
So that peer piece, right, that you hadn't seen before, that's an opportunity for you. All right, thank you so much for the sharing. We got another one down here.
Thank you, Mike Gilbert, class of 20. So my innovation was related to colonoscopy and colon cancer screening at a family health center in Concord that has a very high Medicaid, homeless, substance abuse, and Bhutanese population that had very low screening rates and very high no-show rates at the time of presentation for their examinations. And our innovation was that we were using a grant to install nurse navigators to try to address some of those social determinants that were keeping folks from getting appropriate screening. The feedback from my team was excellent, and a lot of what I took was that I need to stop thinking about things as a gastroenterologist and start thinking much more from the perspective of the customer, and that'll really help us to start to address some of the obstacles that they're running into.
What is one of the things that changes for you when you take the role of outside of the gastroenterologist? What?
They were talking to me a lot about experience-based co-design and using the members of the community to be the most appropriate champions.
Okay. All right. Good. Thank you.
I think we have time for one more.
I think, was there somebody down here?
Cyrus. Oh.
How you doing? Steve Novak, 2019. And my innovation was providing services for women who are addicted to heroin and who are also pregnant, and with the goal of improving maternal fetal outcomes. And the barriers that I ran into were obstetricians and pediatricians locally that didn't want to do it, and they wanted them to be shunted to other facilities that were doing it. So what I heard from my group, and I don't think that's a good solution, because a lot of these women will forego prenatal care because they can't make the 60-mile drive to one of those other facilities. So my group suggested a couple of things, like energizing our coalition to actually put pressure on political forces within the community, and including social media and other activities. And another idea was go directly to payers, Medicaid, and try to carve out special arrangements for increased pay for the practitioners that are going to be doing this sort of work.
All right. Thank you. Thank you. So I know we have, Drew in a minute is going to share some follow-up to what happened when he confronted these hidden barriers and how they responded as a closing. Before we do that, in the last 30 seconds or so, for those of you who were peer consultants and you heard the case, can you just tell us how, if you think that this is the kind of thing that you can use right back at work, can you find the time to put this into practice? Let us know. Put your hand if you think you can do it. Okay. You think you can do it? So it doesn't change the whole organizational culture. It doesn't change all the policies of your organization. It doesn't necessarily address some of these big systemic forces that are affecting us, but it might give you something you can start with to just put that wedge in the process, to give you a little bit of time to check your own thinking, so that those barriers, you'll still see them, but you'll see them earlier and you'll be able to address them sooner. If you have a minute, before you leave, I think that there's any piece of paper on this table, there's a piece of paper that's got names of table assignments. If you could just write down some thoughts, if you have any, about how we might improve this. We understand that we did this in a very short time, so saying make it longer is definitely good advice. This is a 90-minute exercise. It's meant to be done multiple times. You don't just do it once, you could go around and have each group, individual share to your peers, and you could do that every week or every month. So that's kind of how it would be used. But give us some thoughts about how you might strengthen this activity, all right, if you have any. Write on the backs of those and just leave them on the table and we'll take them. With that, I'm going to hand it over to Drew to give us a closing for what happened with his innovations and how did they recover.
So we're both innovations. We actually had the same approach. So the aim didn't change. Cleaner, new parks, farmers market, urban agriculture, entrepreneurship. That was still the goal, but the approach changed. What we did was we slowed down to go fast. In both instances, we were able to build hospital community partnerships, and then from there, use some of the funding to build larger coalitions, bringing in the police department, bringing in moms groups, the school system, and so on and so forth. So for an entire year, both organizations, the ones I was involved with and the one that my friend Will was involved with in San Francisco, we went through the exact same process. We did the UFO exercise. We did asset mapping. We started to build the capacity of the community and really, really learn and hear. And ultimately, it was a success. The urban agriculture program in the west side of Chicago was booming and going great. They even have salad stations in most of the high schools for kids. And I think that was one park. I think there are 3 or 4 more in Tenderloin because they figured out the safety issue. They've also saw other things around homelessness that they're working on, working with organizations like Google and other tech organizations that's right in the Tenderloin, but really wasn't having a connection with the community. Because of that slowing down to go fast, the goal has been met and will be met, but there are other goals that are being met that was not even apparent before. So, thank you.